4,000 years ago, Egyptian surgeons were performing brain surgery, and their patients actually survived. We know this because the bones show clear signs of healing. They also performed complex dental procedures, fitted prosthetic limbs, and wrote the world's first rational medical textbook. Tonight, we open the file on ancient Egyptian medicine.
Welcome to this explainer. Think of this as us cracking open an ancient, highly classified dossier into the empirical reality of Egyptian medicine. For way too long, history has just painted the ancient Egyptians as, magicians or priests who were purely obsessed with the afterlife. But man, when you actually look at the recovered medical texts and the physical remains, a completely different picture emerges. These folks were real, actual scientists. They were incredibly keen observers of the human body, operating in this highly systematic way thousands of years before the Greeks even entered the picture.
So here's our agenda for tonight's investigation. We're going to start with the foundational texts, specifically the Edwin Smith Papyrus. Number 2, we'll look at trepanation and the hard surgical evidence. Number 3, prosthetics, dentistry, and drugs for their fascinating, magical, rational system. And finally, number 5, 3 open mysteries. Let's get right into it.
Section 1. The Edwin Smith Papyrus. All right, let's dive into our first major piece of hard evidence. The Edwin Smith Papyrus is, without a doubt, the world's oldest known surgical treatise. Now, it dates to around 1600 BCE, but the wild thing is, the medical knowledge inside it was actually copied from texts going all the way back to the Old Kingdom around 2600 BCE. The brilliant minds behind this knowledge were known as the Sweno. That's the ancient Egyptian physician, and we really need to treat that title with immense respect. These were highly organized, literate professionals. In fact, in the Edwin Smith Papyrus, the Sweno became the very first scientists in recorded human history to use words like brain and meninges, the membranes enveloping the brain and spinal cord. They were literally mapping out the anatomy of the nervous system centuries before Hippocrates was even born.
And this brilliantly illustrates just how modern their methodology really was. When a shaman saw a patient, they didn't just immediately start chanting spells. No, they followed a strict 4-step empirical protocol. First up, examination. They'd physically palpate wounds and check the patient's pulse. Second, diagnosis. Third, prognosis. And finally, treatment. Honestly, if you work in healthcare today, you're probably not in your head right now. It practically mirrors the modern SOAP note format, subjective, objective, assessment, and plan, that doctors use in hospitals right this second.
Now, these 3 verdicts reveal their highly logical triage system. See, the Edwin Smith Papyrus categorizes 48 distinct medical cases, mostly really severe traumas. And for every single case, the Sweno had to declare one of 3 verdicts. 1, an ailment which I will treat. 2, an ailment with which I will contend, basically meaning the outcome is uncertain, but I'm going to try. Or 3, an ailment not to be treated. And listen, this wasn't them just giving up. This shows us that they objectively knew their scientific limits. When a catastrophic battle trauma was just straight up beyond their capability to heal, they recognized it rationally, exactly like modern combat medics conducting triage on a battlefield.
Section 2. Trepanation and surgical evidence.
But we don't just have to rely on written papyri to prove their medical genius. The indisputable proof is literally written in the bones of the patients themselves. For example, archaeologists have recovered human remains showing clear, undeniable evidence of trepanation. That's the surgical practice of drilling or cutting a hole into the skull to relieve intracranial pressure or treat severe head swelling. Now, you might be thinking, opening a skull in the ancient world, that's got to be an automatic death sentence, right? But the absolutely astounding reality is that many of these skulls show clear signs of bone remodeling and healing. That means the patient survived the brain surgery. The Sweno successfully opened the skull, relieved the pressure, and kept that patient alive long enough for the bone to actually heal over. Just incredible.
And we have to remember the intense context of these injuries. On the left side here, we see the brutal reality of ancient warfare. During the era when the Edwin Smith Papyrus was updated, newly introduced copper weapons, like battle axes and heavy knives, were causing devastating, entirely new types of head wounds. Heck, even Pharaoh Sekenare Ta II died from a copper axe to the skull. But look at the right side. That is the methodical Egyptian medical response. They didn't panic. They developed systematic, standardized surgical responses using precise cranial sutures, splints, and linen bandages, all specifically designed to save their soldiers' lives from these horrific new weapons.
Section 3. Prosthetics, dentistry, and drugs.
But listen, ancient Egyptian medicine wasn't just about surviving bloody battlefield trauma.
These empirical scientists also brilliantly tackled everyday quality of life issues. 3,000. That is the age, in years, of the famous Cairo toe, discovered in an acropolis near Luxor. This thing is widely considered the world's earliest practical prosthesis. It was fitted to a woman who had lost her big toe. And this wasn't just some stiff, cosmetic chunk of wood thrown together so she'd look whole in the afterlife. No way. It is a biomechanical masterpiece crafted from wood and leather. Modern 3D scans reveal that it was meticulously refitted multiple times to exactly match her foot, complete with a flexible joint that actually helped her balance and walk comfortably. They fundamentally understood biomechanics.
Beyond prosthetics, their pharmacological and dental interventions were just highly advanced, and we see a lot of this recorded in the famous Ebers Papyrus. They used honey extensively in wound care, and modern science totally confirms honey is a fantastic antibacterial agent. They fed raw garlic to workers and soldiers to aid endurance and healing. Got a toothache? They applied hellebore. And astonishingly, physical evidence shows they even created real dental bridges. They were literally taking loose teeth and meticulously wiring them back into place or anchoring them to surrounding teeth using delicate silver and gold wire.
Section 4. The magical rational system. Okay, so the crucial takeaway here is that their medicine was remarkably advanced. But we do have to address the elephant in the room. How did this undeniable, rational medical genius coexist with their deep belief in magic, spells, and the gods? Well, it actually makes perfect sense when you put yourself in their shoes. Think about it. If an Egyptian physician could see the cause of a problem, like a fractured arm or a gaping sword wound, they used entirely rational mechanics to fix it. Splints, sutures, bandages. But if a patient came in with an internal, invisible disease, say a sudden fever or an unexplainable stomachache, they had no microscopes to see bacteria or viruses. To them, these invisible ailments were caused by malevolent spirits or a disruption in Ma'at, which is cosmic balance. So, quite logically for their time, they invoked magical religious medicine. They used spells and priests to attack the invisible demons while simultaneously administering medicinal drugs to treat the physical symptoms. It was one fully integrated system.
Section 5. 3 Open Medical Mysteries.
Now, as much as we have decoded from their papyri and their mummies, there's still so much we just don't know. Let's look at 3 open mysteries that modern science is still trying to figure out today. First up, the untranslatable illnesses. The papyri lists several diseases that we literally still can't identify, but what we do know leaves us in absolute awe. For instance, they were able to accurately diagnose the A'ad disease, which modern doctors now know is schistomiasis, a disease caused by microscopic parasitic worms, and the Egyptians diagnosed it based purely on external symptom presentation, without ever looking through a microscope. Wild. Second, the missing instruments. We have texts describing surgical cuts and bones showing literal drill marks, but archaeologists have found virtually no physical surgical instruments from the pharaonic period. Were they melted down? Did they use everyday tools that doubled as surgical gear? We just don't know. And third, the true extent of their influence on Greek medicine. The Greeks widely praised Egyptian doctors, and it is highly likely that famous figures like Hippocrates built their medical foundations directly on top of Egyptian science.
The sheer scale of their empirical knowledge, gathered over millennia of careful observation, is just truly humbling. These weren't primitive practitioners stumbling around in the dark. They were highly organized scientists pushing the absolute boundaries of human knowledge 4,000 years ago. So I want to leave you with this question. What surprises you most about ancient Egyptian medical knowledge? Let that sink in and rethink what you thought you knew about the ancient world. Thanks for exploring this explainer with me.